We all know spinal discs are important, but to understand why, the real question is, what are they made of? Hi, I'm Dr. Vartan Chakalian with Foundation Spine and Well-necessities, and we help the Chicago Northwest suburbs get back to the things that they love most with gentle yet specific chiropractic care. Now, getting back to the question, what are spinal discs made of? Simply put, your spinal discs, they're little cushions that sit between the bones, the vertebra within your spine. Now, each disc, it's made up of a tough fibrous outer layer, which is called the annulus fibrosis, and a jelly-like inner layer, nucleus pulposus, kind of like the jelly within a donut. Now, the tough outer layer, it contains and protects the softer inside layer. Now, these small discs, they have a huge job, right? They enable your spine to move in all different sorts of directions. Now, your spinal column, it has 24 movable bones with spinal discs between each pair. Now, each disc acts like a small swivel to allow your body to tilt and rotate, and the disc's inner layer is mostly made up of water, and that high water content helps keep it supple and movable. However, as you get older, your discs, they tend to lose their high water content and they decrease, which leads to degeneration. Now, degenerative discs, they don't move as well. They're more prone to cause pain, even contribute to the compression of your very, very important spinal nerves. Now, movement is one of the best ways to keep your spinal discs healthy. Now, since the spinal discs, they don't have a particularly good blood flow supply, movement is how they bring in nutrients. It's called imbibition. Now, these nutrients help the discs stay healthy and push out waste that can contribute to pain and inflammation, which are bad things. We don't want those. Now, a couple weeks back, we talked about the three types of movement, right? The first one was regional movement, which is you move your neck as an entire region or your lower back entirely as a region. There's global movement, which is movements like running, walking, squatting, right? These are very important movements that involve your entire spine, not just one region of it. But the most basic form of movement that we talked about was segmental movement. Now, this movement is the movement between the segments of your spine, right? Between the actual vertebra of your spine. This is the type of movement how chiropractors specifically help people, right? So when was the last time you were able to isolate movement specifically and gently at the C5, C6 vertebra, or get specific movement at L5, S1 joint? It's kind of hard to pinpoint, where exactly you want specific movement. But to tie this back into the topic of discs, movement between the vertebra or the chiropractic adjustments is what directly helps these discs, these very precious and important cushions between your spine, to maintain their integrity and to keep them well into your golden years. Now, I'm sure everyone listening to this doesn't want, bone-on-bone degenerative discs when they're older, and I don't want that either, or even the beginning stages, starting in our middle ages, around 30, 40, 50 years old. But, if your neck or your back hurts, just let us know. We're here to get your spinal discs moving and working together better so you can get your life back from pain. But again, this has been Dr. Vartan at Foundation Spine and Well-necessities, and I will see you next week for another episode of Research That Matters.